Good morning, I'm Sunetra Choudhury, National Political Editor of Hindustan Times, bringing you up to speed on Wednesday, April 15th. Our top story, the 40-day lockdown, what could be the impact on the Indian economy? Where the International Monetary Fund has quite a dire prediction. They say that the Indian economy will only go at 1.9%. It's still a lot better off than the global scenario, which they say is at minus 3%. Barclays, of course, has an even worse prediction. They have now revised it. Earlier said in January, Indian economy will go at 2.5%. They're now saying that's at 0%. It's the worst financial crisis we've seen since the Great Depression in the 30s, and definitely worse off than the 2008-2009 crisis. The next story that we have for you is what is the impact of the 21-day lockdown? Well, according to the data that we've analyzed, the disease has grown 20-fold in those 21 days. It's also spread from 85 districts to 380 odd districts out of the total 718 districts. That means there are several districts now, 300 odd, which are still not impacted by the virus. So that's the good news. But the mixed one is that containment zones have seen hits and misses. Ones like BHILWARA have worked very well, but others that are in Jaipur have not worked as well. The next story that we have for you is an ICMR study which was released on Monday, which says that the coronavirus is now growing exponentially in India, and antibody test kits are the key to it. They're supposed to arrive today from China, but they have been delayed before. And states like Delhi say that they're urgently stepping up the testing. So they say over the next 5 days, they're going to conduct 20,000 tests. And just to put it in perspective, since January, they've only done 16,000. So conducting 20,000 in the next 5 days is a significant increase. The next story that we have is good news. Could an Ebola drug be key to tackling and curing coronavirus? Well, scientists say that the remdesivir stops replication of the virus and it's helped in other diseases like SARS. The tricky part is that the patent is held by a US company. However, experts have said that generic makers, because it's a pandemic, could be authorized to use this if the government so agrees and reaches an agreement with WHO and with America. And finally, robots are now serving food and medicine to COVID patients in Jharkhand. Skill center based hospital there. We've seen drones, in fact, sanitizing because of the fear of this disease spreading to health workers. And so in this particular hospital in Jharkhand, from 200 feet away, this robot, which can carry up to 35 kilos, is serving medicines and food. That's all the news for now. You can keep tracking all of them on HindustanTimes.com.